Hi, my name is Valerie Thomas, and I've been asked to share with you my experience with ozone. To start, I'll just give you a little bit of an idea of how I came across it. In 2002, I discovered I had three herniated discs, the L5, L4, and L5S1. I started an epidural regimen, but by July 2021, I discovered that those herniated discs were now degenerative discs and decided to look into alternative treatment programs. I discovered ozone in a chiropractic office, and it has been a life changing um, discovery for me. I'm huge into sports. I love snowboarding and golf, to be specific. I spend probably 3 or 4 days on the golf course, and take the winter off to spend as much time as I can on the mountain. To give you an idea, actually, I'm going to go over my medical history. I had to make flashcards because there's so many. Unfortunately, the herniated disc was just a start. November 23rd of 2002, I was in a massive car wreck. I was 7 months pregnant with twins, as if it didn't have to get more interesting. And just to give you an idea, I've got a photo of the car. I was right there. It was pretty major. I shattered 4 inches of my femur, snapped my femoral head, and snapped my ankle. We did a titanium rod from the knee to the hip, screwed in the femoral head and screwed the ankle, and I was off on my merry way. Unfortunately, about a year or so later, I developed what is called a vascular necrosis, where the bone, the femoral head, just died. It never reattached to the femur. It took me 3 months to find a doctor that would want to touch that. I had shattered 4 inches of the femur in an area where they would essentially need to place the implant, and not very many doctors wanted to dabble with that. So I found one, and at the time they were recommending the metal on metal hip. It was supposed to be really good for younger people. I was like about 20 at that time, and for people who are very active. So I went ahead and I got that metal on metal hip. They took the screws out, and everything was good to go. Except, if you know anything about metal on metal hips, I spent 7 years having my hip randomly dislocate. I remember being confused. I was 500 times the legal, or not legal, I was 500 times the healthy limit of chromium and cobalt. So I had melatosis, essentially, is what they decided to call that. So it required a revision. When we got in there, it had eaten out the pelvis, it had eaten all the tissue. There was black tar everywhere. And so they scraped it out and did the best they could, but they did end up losing my sciatic nerve during that 12-hour surgery. And so they just sewed it up. So the muscles aren't actually attached here on my hip. And that causes some issues, but it was better than the randomly dislocating. And I'm grateful to have that replaced. So then we go further on, and September of 2019, my dog pulls me down a mountain. I roll my ankle, and I have surgery on the other ankle. Going on to January 2020, I was snowboarding, hit a launcher, I guess you would call it, low visibility, didn't see it coming, and I blow out my ACL. I think I tore my meniscus and sprained my MCL as well, but the ACL is kind of like the big point, right? So May 2020, because I just had this surgery, I decided I'm going to sell my dirt bikes, buy four-wheelers, and then I take it up the mountain. And I had taken it up quite a bit, but this one time I flip it and dislocate that hip replacement that's already given me so much trouble. And now I have an 80% chance of dislocating again. So you can imagine that my muscular structure around these injuries has to be very, very strong. So again, I discovered this had degenerated, and then we go into November of 2021, and I find that I have torn my left ACL, and I have to have surgery on that as well. I have used ozone for all of those injuries and have been able to maintain my training. What takes 2 weeks to recover from, and the other time is down to 2 days. I don't have to worry about my maximum oxygen intake being reduced. I don't have to worry about any muscle atrophy. I take a couple of days and then I'm back training. Rehab is a lifestyle for me just because of those injuries. With Dr. Manwaring, I've had 4 treatments. And we have treated the low back, the left and right knee, and right now our focus is my hip and my thigh. I still have some residual pain in the spring and the fall, and so far it's been very effective for that particular issue. What I've tried before has been pain medications, epidurals, relentless physical therapy, ultrasound, anything I could find just to reduce the pain. I have a bad reaction to pain medications. They make me very sick and not functional really. So I that was never going to be an option for me. So it had to be something else. Like I said, the results have been profound. Um, I'm actually able to participate in my sports and I do very well. And I'm grateful for ozone. And it's something that I don't know that I would have had I not discovered it. So I really appreciate that being introduced and want to thank you guys.